Okay, Shauna, let's start with your own menopause journey. Can you tell me about that?
Sophie, my menopause journey was a little bit unusual. Not unheard of, but definitely a little bit more unusual. I was having my cesarean section for my fourth child, and the decision was made during that surgery to remove my ovaries. So that was basically a very sudden surgical menopause with the added, I suppose, drama of going from the heady heights of pregnancy hormones to the low lows of menopausal hormones because my ovaries were completely removed. So often when women have a pregnancy and they will experience the baby blues and things a few days after having their baby because their hormone levels drop. Well, mine definitely dropped a lot more dramatically than that.
That means you didn't have a perimenopausal per se, so you weren't on any hormone medication at the time?
Yeah, that's right. So obviously, usually when you're heading towards the menopause, I'd like to say that it's a gradual reduction in hormones, but obviously that's not really the truth. We call it the zone of chaos for a reason. But if you were kind of to average out what's going on, there is a general trajectory that hormone levels are dropping off over a period of years. And obviously I don't exactly know, but I was pregnant, so clearly, and didn't have any trouble falling pregnant. So I'm presuming that I wasn't anywhere near perimenopause at that stage. So can't know 100%, but definitely I wasn't on hormones, and it was a decision made based on the fact that I have the BRCA1 breast and ovarian cancer gene, and a decision was made at that surgery to go ahead and remove my ovaries. And I think, in the following days, I definitely remember feeling really anxious, but that was also based on the fact that my third child had been very, very ill for a few years after birth, and very quickly within 10 or 15 minutes of my fourth child being born, he also became quite unwell. So I kind of am unsure whether I really had much of an impact of that big hormonal drop immediately, or whether it was just I was feeling very anxious and naturally so.
A lot of women speak about brain fog. Is that something that you experienced? Can you share that with us?
Yeah, I definitely did. And I think that it's something that at that time I didn't know a lot about. So I think what I would say is that I'm answering questions today based on what I know today. But even though I was still a doctor then, I actually didn't know any of this stuff. I had no idea about menopause. I kind of went into it knowing that I wouldn't have any periods anymore and I couldn't have any more children. And probably my sadness around that surgery was very, very focused on that. And I was incredibly naive about the health implications. I was definitely a very studious person at medical school, so I have to kind of conclude that we really just didn't have a lot of focus on it. So I think in hindsight, I probably had brain fog. I just remember just not feeling quite as sharp as I had previously done. But I think, again, there's always reasons to explain it, and women will often tell you that about any perimenopausal symptom. You can always find a reason. You can always think, oh, well, I've got 4 kids, or I've got a new baby, or I'm really tired, or I'm not getting enough sleep, or, I'm looking after elderly parents, or I've got a busy job. Like, it's so easy with most of the symptoms of the perimenopause to find another reason or thing to blame. And it's only, I think, when you start to put a lot of things together that you go, actually, there's a lot of symptoms here are repeating, both from my own perspective and from patients telling me, what does brain fog mean? Well, it's quite different for different people. So for some people, they'll just feel like they're just not as sharp as they were. They're just not feeling like they're on top of things. Maybe they're feeling a bit overwhelmed. They're forgetting things that they wouldn't normally forget. But one of the commonest ones is word finding. So people will tell you that they just can't think of the name of a thing, or they'll be having a conversation with people and there's just a word on the tip of their tongue, but they just can't think what it is. It's often a noun or a naming word. So it's often the name of something. And I've had all sorts of funny stories, and you'll hear lots of things online of people saying that, they can't think of the word fridge. So they'll be pointing and they'll say the cold cupboard, or, they can't think of the word toes. So they'll call them foot fingers. Like, it's that word finding, particularly for a noun, it seems to be really challenging. And I know that I definitely found that I had that. But again, I was thinking I had 4 kids. I was really busy. I had a baby, blah, blah, blah. So I can't say that I knew that that's what I had at that point. But as time has gone on and over the years, seeing more and more women who, quite frankly, often come in to see me and think they've got dementia. So they'll be really nervous because, remember, it may be in their age context. They maybe are dealing with an elderly parent or a grandparent with a dementia type illness, and they'll begin to be thinking, oh my goodness, I'm actually losing my mind here. I can't remember things. I can't remember where I put my keys. Or, people often tell me that they're like looking for their phone, searching for the phone, but they've got their phone the whole time in their hand. And I even had someone the other day tell me that she was talking to her mum on the phone and chatting to her and saying, oh, I'm just sorry if you hear me rustling. I'm looking for my phone because I need to leave. And she was on the phone. So I think, it really does impact that cognition. And I think brain fog is impactful just at home, but it's also impactful in the workplace. So I do see women losing confidence in themselves, not feeling like they're as articulate as they were before. Maybe when they're running a meeting, they just can't articulate. And in fact, literally yesterday, a lady told me that she spoke at a work meeting, and she said the whole team just literally looked at her as if she was crazy because she had completely used 2 made up words in her sentence. And so, as I say, it's really very variable, but it's definitely a common symptom, and one that thankfully people are now talking about.
And you mentioned perimenopause. What are some of the symptoms that women should be aware of?
Okay, so look, perimenopause is definitely a term that has gained a lot of momentum recently, and to be honest, if you'd asked me 10 years ago, what does the word perimenopause mean? I don't even know if I could have told you. So that's just being completely honest. So perimenopause is a variable period of time in the lead up to the menopause. And it can be anything from sort of 3 to 10 years. And in the perimenopause, it is marked by a wide variety of symptoms. So, literally you can start from the top of your head and work your way down. So if we do that, you can have, hair thinning, hair becoming brittle. You can have move down the face, dry eyes, itchy ears, vertigo and tinnitus, dry mouth. You can develop skin rashes, worsening rosacea, worsening eczema, acne that's returning for the first time since your teens. Your skin will be dry. If we stay on the head and jump inside the brain, then you're going to have maybe inability to sleep. So you might be able to not fall asleep. Maybe you can't stay asleep. Anxious, anxiety that you've never had before, or if you've always been anxious, your anxiety is worse. And maybe anxious around things that previously haven't worried you. So maybe you are that person who's used to doing presentations at work and suddenly you're very scared to do them. Or maybe you're someone who's commuted all your life to the city, but you're very, very nervous driving and you can't really explain why. Or maybe suddenly you've got social anxiety. So you used to love going out to see your friends, but now you're making every excuse under the sun. Other brain symptoms are things like, well, obviously we've talked a lot already about the brain fog, just not feeling like you're as articulate as you used to be, or your memory's as good, or maybe just feeling completely overwhelmed, that before you could multitask like an absolute crazy lady, but now you just feel like the slightest thing is tipping you over the edge. So lots of brain symptoms. Also, another brain symptom would be libido dropping off. And for some women, that's a gradual thing, and for others, it is literally falling off a cliff. Again, saw a lot of menopausal patients yesterday, perimenopausal, telling me if they never had sex again, they would be quite frankly delighted, and they just don't care about it. So lots of brain symptoms. If we keep moving down the body, you can have reflux, Heart palpitations is another really common one. So again, definitely needs to be checked out, but don't panic. It's very, very common. And, for years and years, I sent people off to the cardiologist and we did all these investigations and it would invariably come back normal. And interestingly, when you put them on HRT, their palpitations would just go away. Moving on down the body, you can have changes in your gut health. We know there's a shift in the gut microbiome. Often people seem to be a bit more sensitive to foods. They'll complain of bloating. Maybe even the bowels will change. So as I keep going, I'm going to keep going down the body. But then you could end up, at maybe the bladder. So getting up to the toilet to go to the toilet, getting up at night to go to the toilet, which is called nocturia, frequency of running to the bathroom a lot, feeling like they're having to know where all the restrooms are on their journeys because they're anxious that there's so much urgency involved in going to the bathroom that they won't make it. Also, you can have urinary incontinence develop. Then you can have those vaginal symptoms like vaginal dryness. So that can just feel uncomfortable. Tight clothes can feel uncomfortable. Recurrent thrush and recurrent urinary tract infections. And then we can think about things like hip pain. So often women will get bursitis in their hips. They'll feel like they can't lie on their side in bed anymore because it's so uncomfortable. They can get knee pain. They can get plantar fasciitis. So many people get plantar fasciitis and they're like, I don't know what's wrong. And they've got their shoe inserts and they've gone and got new trainers and they're driven insane because it's very uncomfortable. And then you can have frozen shoulders as well, pains in the joints of the hands. So you can see that there is a lot of symptoms. And then you also have the extreme forms of itching is one of them is called formication, not fornication, but form with an M. And that means a crawling sensation under your skin. So, and that's not even all of them. Like there's more than that, but there is a lot of symptoms. So you can see though that lots of those you could put down to other things. And then of course, probably one of the main ones that people come in upset about is weight gain. So people feeling that they are just gaining weight, they're eating the same, they're not doing anything differently. They've maybe always been able to maintain their weight within a few kilos and suddenly they can't. And they're annoyed and upset and feel self-conscious and they've got maybe belly fat that they never had before. And even if they aren't putting on a lot of weight, they will tell you that their body shape is changing. They feel like they no longer have like a nice nipped in waist, that they feel very straight up and down, and that they just have this belly fat that makes their trousers and things feel quite uncomfortable. And then of course there's the fatigue. So that is just people will come in and tell you they are exhausted, that they just want to come home from work and put their jammies on and sit on the sofa. They might have used to be a very outgoing person, but now they are so tired. They've no energy, they've no motivation to do anything, and they just don't understand, where the old them has gone. They often say they don't feel like themselves anymore, and they look in the mirror and they don't recognize the person that they see, both from the outside but also how they feel on the inside. One other common, and I don't know whether you would describe it as a symptom, but it's something that gets repeated to me so many times, is like, I don't feel like me anymore.
Yeah.
And I also feel very disconnected. So let's say they still love their children and their partner and their family, but they just feel like there's a disconnect there that they've never felt before. They feel like there's maybe a bit of a distance and they can't really explain
Quite
it.
right.
Something just doesn't feel quite right. And so as you can see,
Yeah.
that is an absolute ton of symptoms, and people can then feel like they're going crazy because, of course, if you've got all these symptoms that are all over the place, and you go to the doctor and you say, you bring out your long list of 14 symptoms, you can feel like you look crazy. And, potentially the doctor might think, my goodness me, this person is jumping from sore feet to itchy ears to dry eyes to not being able to go to sleep. And to be honest, if the doctor isn't clued in to perimenopause, and I have to say, honestly, even 5-6 years ago, I was only just starting to get, onto it, and I would not have put it all together easily, it can be easy to think, my goodness, this person is jumping from so many, like as a doctor, like where am I going to even start?
Absolutely.
So the great news is, for whatever reason, I think it's been a collision of, social media, access to information, and probably, I think, the fact that lots of female doctors have become the age of menopause and who've gone, what the heck's going on? The reality is that we've got this real momentum right now, and patients are more educated than ever. And in fact, sometimes the patients are more educated than the doctors. On Sunday morning, when I was out walking at Terrigal Beach, which is a local beach, I kept crossing paths with a number of women who all had vests on, just like me, weighted vests. And we all gave each other a bit of a knowing look, because these have become very, very popular in peri and postmenopausal women. You might not know what rucking is, but basically what it is walking with either a weighted vest or a weighted rucksack. I personally opt for the weighted vest because I find it very, very comfortable and very, very quick to put on. So for peri and postmenopausal women, there are definitely a number of health benefits that you can gain from walking with extra weight. One of the health concerns that many women have at this stage of life is developing heart disease. And unfortunately, we know in the postmenopause, the rates of heart disease for women really start to accelerate. So why might rucking or walking with weight change that? Well, basically, whenever you're walking with additional weight, it increases your heart rate more, and it basically makes your heart exercise a little bit harder. So hopefully making your heart a lot more healthy. So that's one of the benefits of rucking in comparison to standard walking. So if you're intrigued and ready to start rucking, my recommendation would be that you start low and go slow. So start by choosing a weight that is 5 to 10% of your body weight at maximum, and take it slowly. Go for maybe a 10 to 20 minute walk at first. Don't decide to go on a 5-hour hike the first time you strap on your weighted vest. So we've been chatting to our friends at Rucksack, and I've got a special discount code for you. So if you go to their website, which is www.rucksack.com, so RUKSAK.com, and use the code Shauna15, so that's SHAUNA 15, you're going to get a 15% discount. So whether you decide to go for a vest or whether you decide to go for one of their backpacks, either way, you're going to get 15% off. Now, let's get back into the episode.
Now, you did touch on HRT. When did you yourself start hormones?
Okay, so this is a complicated and messy story, and I will take a lot of responsibility for that as well. So I think I definitely was in that challenging period of time. So remember, we are thinking of 14 years ago. So we were very much still in that thinking that, HRT equals bad, HRT equals high risk of cancer. That's what everyone was scared of. And that was very much sort of the narrative that was out there. So I always want to put that in the context.
Sure.
And also we were a whole 14 years ago in that BRCA1 genetic predisposition to cancers, etc., etc. Lots of people have different knowledge now than they did then. So there's no blame, or I'm not upset with anyone. Everyone made the best decisions at the time. But basically, when I had my ovaries removed and became postmenopausal, really the thinking was at that time was the smallest dose of hormones that you could possibly take for the shortest possible period of time. And also, if you could manage without it, well, then that would probably be even better. And I have to say that I actually have never, ever had a hot flush, ever. No, I definitely became very hot, and having previously been quite a cold person. So I'm always warm. I'm that person who can climb into the sea and swim, and everyone gets cold and gets out and I'm fine. So interestingly, I did feel hotter, but I never had a hot flush. And so based on the fact that I'd had all this pretty brutal surgery. So bearing in mind, I've already had a double mastectomy. I've had my ovaries removed. I'm only in my early 30s. So in my mind, I'm thinking, okay, well, if I can keep the risk of me getting cancer or having some complication, because bearing in mind, I've watched a number of young members of my family die, I was thinking, okay, well, I'm not having hot flushes. So I'll just do my best to do without it. So at that point, I really didn't take hormones. And then over the years, and again, I feel like such an idiot. And I look back with such frustration that I made these decisions and made these choices, is that I didn't really piece together a lot of the other things that were going on. Because I think, I know at times I was irritable and anxious, but I think I always felt there was another reason that would explain that away. So it just never really crossed my mind for a long time. And I definitely also struggled a lot with the genitourinary syndrome of menopause. So a lot of those symptoms. And I don't really know why I didn't massively put it together. And I think I fell into the trap that lots of women do as well, is that I would maybe take some vaginal hormones for a while and then the symptoms would get better. And then I would just get lazy and not do it. And then, I'd find myself back in the same position a few months later. So that's a very long-winded way of telling you, look, basically, I didn't take hormones for years. And I look back with the retrospectoscope and think, oh my gosh, what have I done to my health? Because of that. And, prior to even having the 4 children, I was always very slim, never ever was big in my whole life. And I piled on a lot of weight. I started to show signs of fatty liver, even though I'm like literally not a drinker. I had like this sort of deranged liver function that was creeping in. And so in hindsight, of course, I'm very sad that I didn't take hormones, but I didn't for a long time. And, occasionally I would dabble in them. But at that point as well, we were using a lot of equine or horse-derived products.
Okay.
And then I went through a period of like hearing about these poor horses being tied up and kept perpetually pregnant. And so I just didn't feel comfortable with taking those. So I definitely mucked around a little bit. So I kind of would do it for a little while and then I would stop again. And then in fact, during COVID, I was on HRT, and then that HRT, which I quite liked, was then unavailable. And so I stopped again. So I've probably only really been consistently taking HRT for the last sort of 3 years.
Okay.
And if I could go back in time, I would, of course, for all the health benefits. And, the reality is for me, I'm on that cusp of, I'd say never say it, it's never too late, but I definitely have missed an opportunity, especially as a very young female, to have no hormones. I think that was not good.
So, Dr. Shauna, can you take hormones for the rest of your life?
Yeah, absolutely. Well, I mean, that's what I'm planning to do, to be honest, trying to make up for lost time. I mean, I think it doesn't really make a lot of sense to me. So, for example, if you're taking hormones and you're hoping that it's going to do the preventative things like, for example, help prevent heart disease, if you take your hormones for 5 years, then during that time, it's very protective against heart disease. Doesn't mean you can't go out and start smoking and eat donuts every day, but it's very protective. But the moment you stop that HRT, you actually then move into the same realm and you start having the same risks for not having the hormones. So in my mind, my reading of the evidence is for the vast majority of women, not all women, but the vast majority of women, I think that you would probably want to take it long term. And, even if you think of vaginal hormones, which is not necessarily what we're talking about with HRT, but to me, that is definitely one that you would want to take, I think, forever. When I think of all these older women in nursing homes with their recurrent urinary tract infections, their recurrent spells of delirium with their recurrent UTIs, their urinary incontinence, their prolapse symptoms, I often think, my goodness, how would that have been changed if, one, they had been on HR or vaginal hormones, but if they were also kept on them, and what would the trajectory look like? So you're definitely going to be prizing them from my cold dead hands.
And I think a lot of women would like to know, does the brain fog go away? Does it get better?
Yeah, look, I think it does. And I think it often improves quite dramatically. Estrogen definitely helps a lot. and which we understand now, because we know that estrogen is we've always thought of estrogen as being this hormone that's all about our ovaries and eggs, but we're now realizing that it's from everything to do with our brain, our skin, every organ in the body. So absolutely giving estrogen back will improve things. Lots of women will say that. And also testosterone seems to be really quite helpful as well. So I think, it really does depend on the person. But if we think about it, like libido is a brain symptom. Libido is something that is in our brain mostly, particularly in women. And so we know that testosterone helps libido. And I think it's naive to think that that's the only job that testosterone does. I think a lot of women will find that their mental clarity improves with testosterone as well.
Now, I've heard you talk about sleep hygiene. What is sleep hygiene and how can women improve their sleep hygiene?
So, yeah, sleep hygiene, it's always a funny thing. I always remember even at medical school when they introduced the concept of sleep hygiene, I always thought it was the weirdest phrase, it's really looking at the habits and the environment that you place around your sleep routines. And I suppose in simple terms, it's how you're going to clean up your routine to make it as conducive to a sleep environment. So I think whenever we think of sleep hygiene for any person, but especially, someone in perimenopause or menopause, so the first thing would be that obviously we know that there's something wrong with that sort of heat sensor in the brain. And often for some women, it's just running hot like I did. And for other women, it is that overwhelming flushes or night sweats. So the first thing is to keep your bedroom quite cool. You definitely don't want to be overheating. So keeping your bedroom probably a couple of degrees cooler than you think you want it to be. And the other reason for that is we actually know the human body needs to drop about 0.5 to 1 degree to actually fall asleep. And that's why it's so hard to go to sleep on a really hot night, because you just can't get that temperature drop. So I think keeping your room cool. I also think that having your room your bedroom as an environment that is actually conducive to sleep is really helpful. So, having, all those unpaid bills laid across your bedroom floor, or maybe having all the black bin bags that you've cleared out your wardrobe 2 weeks before and not getting rid of them. So I think it's just, being sensible about trying to make the environment really nice. I think, we know that darkness helps. And, I'm very, very guilty of this one. But, it's not having that light from your phone or your iPad. So it's very tempting to lie in bed and look at your phone and scroll and things. And there's multiple reasons why that's not helpful. One, it's very activating to the brain. So you're kind of waking yourself up. But it's also the light is confusing the brain, because we want melatonin to be released to tell our body it's dark, it's time to go to sleep. But then we're shining this bright light. And so our body's going, oh, hold on, actually, maybe it's not nighttime. So let's turn that melatonin off. So I think darkness, coolness. I think the bed with lots of layers, so that you've got like a throw or something on the bottom that you can pull up if you get cold, but you've got layers that you can just sleep with a sheet. I do think it's probably time, if you're in the position to do it, is to buy yourself some really nice sheets, trying not to use, man-made fibers and things that are going to wick away moisture and make you feel most comfortable. And then it's also about thinking about what you do before you even get towards your bedroom. So,
Sure.
not having really stressful phone calls with people that, wind you up, or, not watching some really scary, murder mystery on TV, or, documentary about a serial killer is probably not going to be conducive, or not having a really heavy meal or eating lots of food that are going to have, you're going to sit there, and we've all done it, eating the popcorn and the Maltesers, watching a movie, but then expecting yourself to, 20 minutes later to be trying to go to sleep. So it's just being very mindful about, your environment and what you're doing beforehand. You know, a lot of women will tell me that they can no longer drink alcohol. We don't entirely understand why. There is some studies going on about that now, but alcohol is often something that people struggle with in peri and postmenopause. They'll tell you that they get a terrible sleep, they get waking up during the night. So definitely avoiding alcohol caffeine's a bit of a no-brainer. We know it's a stimulant, so not having a coffee, late at night, so it's going to keep you awake. But, also other drinks. So lots of people will drink, fizzy drinks and Coke and things at night. And again, you're just giving yourself another stimulant and making it really hard to go to sleep. I think the other things are, trying to have a bit of a routine. We all think back to our teens whenever we wanted, like at the weekends, to have a big sleep in and get up really late. But what we know is actually for sleep, it's really better to be consistent. So, trying, to have a reasonably consistent bedtime and a reasonably consistent waking up time. Otherwise, your body doesn't really quite understand what routine you want to have. And I think the reason that sleep hygiene is so important in this period of life is that, look, we're already feeling exhausted. We're already feeling fatigued. We're already feeling not great. Going to sleep and staying asleep is already a massive challenge. So you want to kind of have all the other bits, all your other ducks in a row. So that if you do get that opportunity to actually go to sleep, that you can. I think also they say to try and keep your bedroom for sleep and intimacy only, and try not to have it for TV watching or eating or whatever, or studying, so that you're not always associating your bedroom with something stressful.
Yeah, sure. And what do you want women to know about perimenopause and menopause?
I think for me, what I want people to know is I want them to understand what it is. And ideally, I'd love them to understand long before they get there, so that it's not, frying pan in the face kind of experience. And I think the other thing is that I want women to know that it's actually not something to be terrified about, because actually can be really proactive. So, it's about trying to get, you're eating great. So you're having your enough protein, and you're having your fiber, and you're on your omega-3 fatty acids, and you're hitting all those nutritional goals, and that you've been building your muscle, and that you're going into it with great bone mass, and you've got your mental health in a good place. So maybe you've already found yourself a great psychologist who you talk things through with, and they're there to give you support, and that you've chatted it through with your family and your partner, so that that if you do start to go into a period of time that feels really, really tricky, that you're going to have an ability, or that you're going to have a bit of a deal with your best friend or your mom or your partner, that they're going to ask you like what is going on, and that you're going to be okay with that. So I think it's about being proactive and not being scared about it. And I think also knowing that there's so many positive things that come with this time of life. I think lots of women, and you can read it lots of places online, that people will say they've just got to the point where they're deep down much more comfortable with their opinions and who they are. They're much more clear about what their boundaries are and what they're happy to say yes and no to. And I think for a lot of women as well, it does bring some freedoms to explore, career or entrepreneurship or friendships or exercise or hobbies that they've never had time to do. So I think what I'd like people to know is that it doesn't need to be this doom and gloom thing, that it's going to be horrific. I think it's about getting a team around you, and, even just having a really good friendship group, or even an online community that you can ask the questions, and probably not to bury your head in the sand. Because even if you are one of these unicorns, and there are some who sail through the whole experience, the realities are that the post-menopause brings health challenges to all women, whether we like it or not. And it does change our trajectory of risk for heart disease, for osteoporosis, and also for probably dementia as well. And also for strength, for, being as fit as we want to be, increased risks as we get older of falling over, etc. So I think go into this naively at your peril, and go in armed with as much information. And I think that you can not only survive, but absolutely thrive.
Dr. Shauna, you ask all of your guests what would they advise their 20-year-old self. So my question to you, what advice would you give to your 20-year-old self?
Sophie. Gosh. I think that I would probably tell myself to try and enjoy the ride a little bit more and not to be so hard on myself. I was a doctor from I was 23 years old, so I was pretty young, and I had this very clear intention to be a pediatric surgeon. And I began my postgraduate training to be a surgeon, and I then had 2 small children quite quickly, and I really wrestled with my decision to step away from surgical training to be a general practitioner. And I think I would probably tell that girl who had sleepless nights and lots of tears and feeling guilty about being at work all the time and not seeing my 2 children, and then feeling guilty when I was at home that I wasn't studying or working hard enough. I would just tell that girl that she made the right decision and that she chose a pathway that has worked out really, really well. So I just probably wish that I'd been a little bit kinder to myself about that instead of feeling like I was failing at both jobs.
This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.